Okay, it's time for our weekly checkup with Santa Barbara County Public Health, getting the latest on the pandemic. Vando Reynosa is back with us live today. Thank you so much for joining us.
Good morning. Hello there.
And thank you so much for joining us. Again, we're going to talk first about vaccinations for kids. It's a big deal here, especially in our county. Kids ages 5 to 11 years old can now get cleared to get the vaccine. What can you tell us and how are you preparing for this?
So we are thrilled at the possibility of 42,000 children ages 5 through 11 in our county are now eligible to be vaccinated, and they will be vaccinated at pharmacies, pediatric or medical offices, as well as public health sponsored public clinics in schools.
And these are mini doses for the kids, and they have to get them back to back. Can you just talk about that and any sort of side effects that we may know about right now, just to kind of ease parents who are concerned about it?
Sure. So our team, as well as our providers, are very prepared to vaccinate children. The vaccines for children will arrive at provider offices in a specially marked vial with different caps. They will be administered via smaller syringes, and it is anticipated that children will feel some level of side effects, sore arms, maybe a little fever, something typical of other vaccines that children are familiar with.
And kids aren't necessarily that susceptible to the virus, although they do get it, and some of them have been hospitalized. What's the main reason for getting them vaccinated so people know about that?
Sure. So children can be infected with SARS-CoV-2. What we want to do is ensure that our children are safe, and the vaccine will prevent them from getting COVID-19. We know that some children, when they are infected, will suffer poor outcomes. And so we want to make sure that our children can get the vaccine and be protected, and also stop the transmission. So meaning their parents, their grandparents, their older brothers and sisters may be vaccinated. So now is the opportunity to protect the younger children as well.
Okay, and let's talk about indoor mask mandate. It was supposed to expire tomorrow, but we're getting word that it may be extended. Can you tell us how long you're going to extend it for and the reasoning behind it?
Yes, so we currently still have substantial transmission in our county. So therefore, we have renewed the indoor masking mandate until December 5th. The order will be lifted when our case rate at this point in time, it will be lifted when the case rate is 6 per 100,000 and stabilize for at least 2 weeks. We are in conversation, in discussion with our colleagues throughout the state, and may look at other frameworks as well.
Okay, and let's talk about the case rate. Just dive more into that. What are we seeing right now in the county?
So as of our 4-day lag, as of October 29th, our case rate is at 8.3. So what this means is that we're glad to see that case rate is continuing to trend downwards in our county. But we are seeing minor upticks in previous weeks as well. We do anticipate that with winter coming and with holidays coming up, more activities will be moving indoors. Community members will be traveling. So we are really encouraging community members who have not been vaccinated to do so prior to the winter season. Our case rate right now is among the unvaccinated individuals is still 5.5 times higher. So unvaccinated individuals are, we're seeing a case rate of 18.3 per 100,000 versus the 3.3 among individuals who are vaccinated.
Okay, thank you so much. Very important information, and we appreciate you joining us, Fando Reynoso. Thank you so much.
Thank you.